Good afternoon. I'm Tania Reddick, 911 Director for the City of Baltimore. Our 911 specialists at the 911 Center are there to take your calls 24 hours a day, 7 days a week. Being one of the most challenging professions, the 911 specialists take about 4,000 calls a day for all types of emergencies, fires, accidents, crime, and are trained to give life-saving instructions for those experiencing medical emergencies. We help deliver babies, help missing children find their parents, calm scared residents during a fire, and more. Importantly, our 911 specialists remain calm, compassionate, and are efficient in triaging emergencies and getting you the help you need. Today, we're excited to announce a new tool that will be available in a few short weeks to 911 specialists to help direct the most appropriate resources to certain behavioral health-related calls. Over the past weeks, my incredible team has been receiving training, diverting certain behavioral calls to clinicians. Mayor Scott has visited the 911 call center twice in the past weeks. We are very lucky to have so much support from the mayor and his team. Our 911 specialists are real people helping people. 911 is always there, we're always ready, and we look forward to this new opportunity. I'll now turn things over to Mayor Scott to describe our first 911 Diversion Pilot program. Thank you.
Good morning, or good afternoon now, and thank you, Director Reddick, and thank you for the work that you do every day in leading some of Baltimore's finest but often unsung heroes and what they do to serve the citizens of Baltimore every day. And before we dive in, I want to remind everyone that today is Fallen Heroes Day, and let's please take a brief moment of silence for all the brave women and men who have lost their lives protecting this great city. Thank you, and we have our flags at City Hall at half-mast in honor of our fallen heroes. Defining what public safety and policing looks like for a community is the most consequential decision that any local government can make, and I have accepted this charge as the mayor of Baltimore. I think it is very clear that the status quo for public safety in this city and across this country is not working. It didn't work yesterday, and it's not working today, and it won't work tomorrow. But this 911 Diversion Pilot program is an innovative step in the right direction. This pilot is not about defunding police, but rather acknowledging that police departments cannot tackle violent crime. Our fire department cannot tackle public health and fire and mental emergencies and everything else. This is what this is about. The Baltimore Police Department is not comprised of substance abuse, mental health, or trauma counselors, and neither is our fire department. Yet, our 911 call center receives nearly 13,000 emergency calls annually related to behavioral health matters. Can you imagine how much harder your job would be if you receive over 1,000 calls a month to tend to matters that you are not equipped to handle? Calls to focus on fixing situations that you are not trained to fix. People that are in need of help that you are not trained to give them. I don't know about you, but I would mind my business, stay in my lane, and leave it to the experts. In this spirit, Baltimore must lean on trained professionals and health institutions like Johns Hopkins University School of Medicine and the University of Maryland Medical System to deliver the necessary clinical care for citizens in need. The 911 Diversion Pilot aims to get the right outcome for callers whenever they dial 911. And I want to emphasize that this is a small step to a larger systems-wide overhaul that must take place. But we have to take this small step first. We have to build to see how this works. We cannot go from 0 to 100 because we are talking about people's lives in this instance. Importantly, this program also aligns with the requirements of our consent decree and I'm committed to fulfilling our mandate to fill gaps where they are needed and divert behavioral health and other calls to the best possible resource. Upon taking office, the urgency of this moment for me, know that this urgent moment demands coordination across different agencies and local partners. Today's announcement, as you can see, helps achieve this. And upon taking office, I directed our agencies to develop a 911 diversion program. After several months of hard work and collaboration, I am pleased to be able to share this news with the citizens of Baltimore today. Today's announcement is groundbreaking. While some jurisdictions have started similar efforts, Baltimore is on the cutting edge for big cities by implementing this program. But I want to be very clear. We are intentionally starting small. Why? The matter is too important to simply do it fast. I'm committed to doing this the right way by evaluating our daily progress and shifting course as needed. Additionally, the Collaborative Planning and Implementation Committee, also known as CPIC, a working group comprised of a wide range of individuals and organizations working to improve encounters between law enforcement and people with behavioral health disorders, will assist in evaluating the program's outcomes. They will also make recommendations for how the city can adapt and grow its public health diversion options over time. I want to thank everyone involved in this endeavor. We simply could not and we would not be here without the hard work of Chief Ford, Director Riddick, who we heard from, Medical Director Ben Lawner, Captain Scott Brillman, Edgar Wiggins from BCRI, Commissioner Harrison, Major Bartness from BPD, Paul Minicerelli from BPD, Allie Smith from the Mayor's Office, Krista Taylor, and the entire team of BHSB who allows us to be in their space today, the Mayor's Office of Performance and Innovation, and Senator Chris Van Hollen. And before I close, I want to also acknowledge that May is Mental Health Awareness Month. Please be assured that when you call 911, Director Riddick and her team will always be responsive to get the call or the help they need. I also want to remind our residents of one more resource. Residents can call the Here to Help line directly at 410-433-5175. Again, that's 410-433-5175. It's free, confidential, and available 24/7, 365. And now I'd like to bring up our fabulous partner and senator in the United States Senate from Maryland, Senator Chris Van Hollen.
Well, good afternoon, everybody, and I want to start by thanking the mayor. Thank you for your leadership on all issues you're facing the city, but especially as we gather today on the issue of public safety. This is a very important launch of a pilot program. It's going to save lives. It's going to get more people the help they need from the experts that can deliver that help, and it's going to allow our police to focus on those emergencies where a police response is necessary and not on those situations where it's not. Commissioner Harrison, thank you, and all the men and women who are part of your force, and to all of our folks involved in public safety. As the mayor acknowledged, this is Fallen Heroes Day, and we want to thank all of you who put your lives at risk to protect the public. This is about making sure that when someone calls 911, they get the kind of response that's warranted and appropriate for that situation. I want to thank our 911 team leader and all the people who service those calls for what you do, making those decisions in short periods of time. Because if we look around the country, and I've been working on this at the national level, too often what we find is that police responses to non-violent situations and encounters have resulted in unnecessary escalation and unjust deaths. The nation witnessed just such a death in the case of Daniel Prude, 41-year-old black man from Rochester, New York. His brother had called 911 when Daniel was acting erratically because of PCP. The result was he was handcuffed, a hood was put over his head, he was put on the ground, and he died from lack of oxygen in a period of time. Those kinds of situations would be much better addressed by dispatching individuals who were trained in dealing with a mental health situation. And that would also mean that the people dispatched could connect the individuals involved with the services they need. And I want to acknowledge the mental health service teams and behavioral health teams that have been part of launching this pilot program. A Vera Institute of Justice analysis of 911 data from 5 localities found that non-emergency incidents were the most frequent type of calls for service in each jurisdiction that they looked at. In other words, most calls that came in did not involve a real emergency. And that 70% of the 911 calls did not relate to any type of crime. 70% in the 5 jurisdictions they looked at did not relate to any crime. And yet, if you look at the 2020 data, you'll find that 58% of people who were killed in encounters with law enforcement were people who were involved in calls to nonviolent situations. Those include behavioral health situations, traffic stops, and a range of other situations. It is also a fact that people with an untreated mental illness are 16 times more likely to be killed in those police encounters than people without mental illness. Clearly, as the mayor has indicated, a one-size-fits-all response does not serve the public safety interests. You wouldn't call a lawyer to deliver a baby, and we shouldn't call upon our police to have to respond to all these other situations where they are not adequately trained. So as the mayor has indicated, this is as far away as possible of defunding the police. What this is about is making sure that the police resources can be focused on those situations that require a police response, that those resources will focus on a situation where violence is a possible outcome and where you need potentially a use of force response, and not devote police resources to these other situations where it's not necessary. I'm pleased to have been working with the mayor as he and his team work through this in the city of Baltimore. I introduced legislation at the national level with Congresswoman Karen Bass in the House last Congress, and we are going to reintroduce that bill in this coming week in the Congress. What that bill does is encourages jurisdictions like Baltimore, supports jurisdictions around the country to move in this direction by providing $100 million a year of federal funding to jurisdictions that want to move in this direction. And that's $100 million a year for 5 years. It's not a mandate from the federal government. It's simply resources to help bring about systemic change, the systemic changes that we need to save lives and prevent unnecessary escalation, to connect people with the services they need, and to allow police to focus their resources where they're needed most. So in the case of Baltimore, because of the mayor's leadership, you're moving ahead without that federal support, and I salute you and your team for doing that. But I do think that Baltimore now can be a national model for how we can make this kind of systemic change. As the mayor said, we're starting with this one step related to behavioral health. And as we move into it, we can look into expanding it to other situations where police responses are not necessary. But it's, thank you for the invitation to join you, and I look forward to Baltimore City being the pilot for the country when it comes to this important kind of systemic change. And now let me turn it back over to the mayor. And if I leave before the questions, I apologize. I have another event. I'm going to stick around as long as possible. Mr. Mayor, thank you.
Thank you, Senator, and thank you for your leadership. And you know, I value your partnership, and we look forward to working with you in support of the legislation. While we are hit of the pack, so to speak, we would love federal support, so we'll definitely be there and always appreciate the tough work that you do of making the right decisions and not the popular one, of being ahead of so many when thinking about how we can do this work of reimagining policing. So I just want to say thank you for that. Next, this will be the last time you hear from me before we take questions. I want to invite up a young lady who this simply would not be happening without. Our fabulous Deputy Mayor for Public Safety, Sonny Schnitzer, who has been working on this effort each and every day and who works hours each and every day to try to help make Baltimore a safer city, but also a city that is smarter about how we are tackling an issue that has been plaguing our city for decades and generations. Now I'll turn it over to you, Madam Deputy Mayor.
Thank you, Mr. Mayor, and thank you, Senator Van Hollen. I want to thank both of you for your leadership and your vision, but importantly, I really want to thank you both for taking the important steps that we need for implementation. So very briefly, I'm going to talk a little bit about what this will look like, what callers can expect if their call is diverted, and then you'll hear from people a lot smarter than I am about what to expect once your call is diverted, and kind of what's to come. So as the mayor and Senator Van Hollen have said, some 911 calls are best served through community-based responses and supportive services. These calls, as we've mentioned, may include things like residents who are experiencing a behavioral health crisis, and they benefit from being connected to a mental health professional or clinician rather than a police officer or a paramedic. And I want to reiterate that while we do intend to grow our diversion options, we are starting small. So after a deep dive into our 911 call data and after countless meetings with our local experts and kind of digging through what options we have, I'm excited to announce that in early June, the City of Baltimore will begin this pilot program. What we will be doing is, through the priority dispatch medical protocols, 911 specialists will interview callers that have accessed the Baltimore City 911 system for help. They'll do a quick assessment, and for those, if a call is identified as an appropriate referral, and we can talk a little bit more about what those referrals are, a subset, and that's a subset of that kind of 13,000 that the mayor was talking about. Those calls will be the 911 specialist will be connecting the caller through the 911 system to a trained mental health clinician at the Here to Help line, which is operated by BCRI. BCRI is here today, and we'll hear a little bit more from them about what that response is going to look like once that call has been transferred. So once that call has been transferred, the caller can then work with a clinician, and a mobile crisis team may or may not be sent out to the scene, depending on the assessment at the Here to Help line. So I want to emphasize, something that's very, very important to this process is that we will be continuously evaluating this dispatch protocol. And we'll be looking at the different factors that go into determining what calls we'll be diverting, to expanding that, to kind of changing and adapting our approach. So during this pilot, there will be daily quality assurance meetings to evaluate the responses to all calls that are diverted to ensure the pilot's success. That's going to be led, it's going to be a multi-agency approach. It's going to be led by our medical director, Director Lawner. And then, an added piece to this is that in addition to doing kind of that process evaluation and quality assurance evaluation, the mayor has also assigned a data fellow from the Office of Performance and Innovation to continually track the outcomes of this pilot. So as Mayor Scott mentioned, this outcome-based evaluation will be tracked not only internally, but also externally with the experts on the CPIC committee who will offer subject matter expertise and guidance on how to adapt and grow and refine the program. And as we make adjustments, I want to be very clear that we intend to be very public and open about what you can expect from this program and any growth or changes. When you call 911, you should always know what the response you'll get will be. And while the 911 diversion program that we're announcing today is an immediate step, the city intends to, as I've said before, expand this beyond behavioral health responses. And this includes leveraging our local expertise on a number of areas, including use of peer supports, housing opportunities, and community-based youth diversion. I'll now turn things over to Director Edgar Wiggins from BCRI to talk about the Here to Help line and mobile crisis response. And I want to thank him for his leadership on this.
Thank you very much, and good afternoon. My name is Edgar Wiggins. I am the founding executive director of Baltimore Crisis Response, Inc., affectionately known as BCRI. We are the city's first and only comprehensive behavioral health crisis service. Among the services that we offer are a 24-hour crisis hotline. That hotline probably currently takes in the neighborhood of 40,000 calls a year. That call is staffed by trained crisis counselors who deal with a range of calls from people who simply are looking to get connected with services, all the way up and including people that are in a suicidal crisis. So our crisis counselors are quite skilled and able to assess calls and provide the appropriate level of intervention. In addition, we also operate mobile crisis teams. Our crisis teams go out throughout the city, 24 hours a day, and respond to people in distress. Our crisis teams are staffed by a licensed mental health clinician and a registered nurse. That team is able to go to locations, assess people, and provide the appropriate level of intervention. In addition, we also have residential services that can treat people for mental health crisis situations and substance abuse and addictions disorders. And finally, our organization responds to traumatic events as they occur. Now, given that range of expertise, I am incredibly excited about the partnership that has developed between our organization and the various partners. It's wonderful to hear the mayor, Senator Van Hollen, and see other folks like Martin Bartness, Major Bartness, who we've worked with in training officers and working closely with the police department. What individuals can expect when they are diverted to our line is, first of all, a compassionate listener who's well-trained and able to help that person with their difficulty, which may involve connecting them with treatment resources. Certainly may involve crisis counseling and emotional support, but if it's necessary, a mobile crisis team can also be dispatched to that person's location to work with them in person. This is a wonderful opportunity for the city. It's a wonderful opportunity for my organization. I appreciate all of the support that we've gotten. As all the speakers have said, this is going to be constantly evaluated, so we know that what we're doing is effective, and so if there are things that need to be changed, we can change them. Thank you for your attention.
Good afternoon. I'm Krista Taylor, the President and CEO of Behavioral Health System Baltimore. Thanks for joining us as we kick off this important pilot to divert behavioral health 911 calls to the city's Here to Help hotline. This pilot is a major step toward creating a behavioral health emergency response system that better serves people in need and reduces unnecessary involvement of police officers. I want to first thank Mayor Scott for his commitment and leadership in advancing this pilot, as well as the reforms needed to better support health and wellness in our communities. Thank you, Mayor. Baltimore's 911 call center receives approximately 13,000 calls a year from people who need help for a behavioral health crisis. This tells us that our police spend a considerable amount of time responding to the behavioral health concerns, when we know many of these calls can be safely resolved without police. The 911 Diversion Pilot will change this by having well-trained mental health professionals respond to people in need. I want to thank Police Commissioner Harrison for his partnership with the behavioral health system and his leadership in enacting change within the police department. Thank you, Commissioner. Mental health professionals will now be central to the city's response by connecting 911 callers directly with counselors at the Here to Help hotline. The Here to Help hotline operates 24/7, 365 days a year. Call operators can offer on-the-spot counseling, connections to behavioral health resources, and can send trained experts to help people wherever they are. I want to thank a few people that have helped make this happen. Deputy Mayor Sonny Schnitzer and Major Martin Bartness for their perseverance in seeing this through. Chief Niles Ford, Dr. Ben Lawner, and Captain Scott Brillman for diligently working through the details at the fire department. Health Commissioner Letitia Jaraza for her support of BHSB and carrying the mental health message forward. Baltimore Crisis Response and for ensuring the services are readily available. Thank you, Edgar, and to your staff as well. I also want to extend my thanks to Senator Van Hollen for your ongoing support of the transformation that is happening in Baltimore City. The Here to Help hotline is an incredible resource to help people who are in crisis or may just need assistance finding services. I'm asking all of you to please help spread the word about Baltimore's Here to Help hotline. Free emotional support, confidential advice, and help getting treatment, please call the hotline at 410-433-5175. Thank you.
Thank you. And now we'll take questions. Dave?
For the pilot program, can you tell us how many crews or clinicians will be able to mobilize when they receive that call, and how many will be on standby for the city?
I'll let the deputy mayor and Edward, yeah, you can give the direct answers. Thank you, Mr.
Our hotline is staffed 24 hours a day. Our mobile crisis teams are staffed 24 hours a day so that they can be deployed.
But how many in those mobile?
All told, I pay probably 170 people full and part-time every 2 weeks to provide those services. In terms of mobile crisis staff, we probably have, at this point, I would say approximately 30 staff who are available to respond to calls.
Thank you, Alexa.
Good afternoon. As the city is rolling this out, is there any liability concern should the wrong medical professional be dispatched and someone is hurt? And if that is a concern, are there any safeguards in place?
So we always have safeguards in place, and we know how the city, and we work with these individuals. This is about expanding, Alexa, a partnership that already exists with the city and these organizations. And the city, we all are always going to take the safety of everyone involved. But I think what you're hearing from us here today is that we all collectively know that this is the right thing to do for our citizens, the people who live here in Baltimore, those who may be visiting Baltimore and calling 911 while they're here, and all of those things are always considered and will be a part of the evaluation process.
So what would those safeguards be?
We cannot disclose internal safeguards and policies that are talking about public safety with you. We can give that kind of detail. That's stuff that we have to keep internal in order to keep our workers and the folks who are doing this work safe.
I have a question about funding.
Emily?
Okay.
Mayor, I'm curious what this initiative is going to cost, and will this be new contracts with these organizations or built into existing contracts?
This is, right now, this is in our existing contract, so this is not costing, this pilot is not costing the residents of Baltimore any extra funding.
So BPD has an existing crisis response team. I'm wondering if they'll be working alongside this or what the future of that program looks like.
Yep, Major Bartness is coming over now. He will address that.
Yes, the crisis response team with the Baltimore Police Department will work hand in hand with all of our partners, Behavioral Health System Baltimore, BCRI, the Mobile Crisis Response Team specifically. We work hand in hand. We talk every day. We have multiple meetings every week. We don't operate in silos. This is the system. Thank you.
Sir?
Just curious, Mayor, is there a percentage of the number of police officers that you're looking to, I don't want to use the word redirect here, but that would be available for other calls? Is that something that you're looking at, and is there a number in this discussion here that would be available for other situations that are going on?
It's a great question, but I think this is the best way that you can answer that question, because we have never done this before, and you heard the numbers, the sheer amount of calls. Think about that and the sheer amount of hours that our police officers are actually out dealing with something that they're not trained to do versus being out there going after someone who's committed a armed carjacking in the city, or building a relationship with a young woman who owns a house and has had some problems on her block. That's what we should think about. As we get into this pilot, this is why we're taking this approach, so that we can see what this creates. The data will allow us to see how it's being able to help us as we expand that on to show how we can really truly reimagine public safety, but more importantly, to allow people to do the things that they are trained to do.
Thank you, Mayor.
Oh, go ahead. The deputy mayor wants to add. Sorry, Ms. Collins.
Sorry, I did just want to add, as a part of our evaluation, the primary outcome that we will be looking at in terms of measures of success for this is a successful outcome for the caller. So while we do expect there will be, potentially benefits in terms of freed up officer time, our primary metric of success is positive outcomes for people who call 911 who are in behavioral health crisis. So while we'll be measuring kind of along the way the different kind of systems that are engaged and how this results in changes in time, our primary measure of success is really making sure that we're delivering the right services to people when they need them.
Yes, thank you very much. If the situation escalates in the wrong direction, would it take another 911 call, or would the person on the helpline have the ability to call police and send a unit out there?
If you think about our history handling crisis calls, that is more than 28 years, we've learned a lot with that. So our workers are very skilled. However, if things do not go the way that they should, we do have the ability to work with law enforcement to resolve that situation. That may be the crisis response team, which has specially trained police officers and a clinician as part of that team, or requesting a crisis intervention team trained officer to assist with that situation. So these are things that we've been dealing with for a long time. I think we do it well. I'm pleased to say that we haven't had tragedies regarding our responses. One of the things that you learn when doing crisis work is you're constantly assessing and reassessing your interaction with that person to make sure that things are going the way that they should. So, yeah, we've got contingencies.
Thank you. Alexa?
I wanted to clarify about the funding. You said it's not going to cost any additional money, but it was my understanding that the Here to Help hotline would have to be hiring more people to field the calls. Could you clear that up for me?
Again, this is in our existing contract and relationship with BCR. That's nothing else.
Yeah, hi. The Here to Helpline has been around for a long time, and this will be managed solely within the capacity we have, the existing capacity within the Here to Helpline. No new additional funds are going in.
So more people aren't being hired for this?
No, we are fully staffed, and Edgar, you could speak to the staffing situation at the hotline, but no additional funds, and we are managing, the Here to Helpline is active right now and taking calls right now. This is just going to be one more call that would come in, or two more calls, or however many.
Thank you. Dave? Last question? Yes, sir.
Yeah, for the 911 dispatch, you mentioned how when a caller calls into 911, a member will kind of assess quickly. Could you just give an example as to when then that caller would be transferred to the behavioral staff, or when the decision would be made to deploy a police officer or an ambulance?
Okay, so based off of the protocol that we use, which is called the Emergency Medical Dispatch Protocol, we just go through a scenario of questions to ask, and based on the questions that was answered, it determines if we're going to actually send out police or fire, medical, or if not, we're going to transfer it to behavioral crisis. So as of right now, it's the low obscurity calls, the ones where someone is not actually threatening suicide, or they are threatening suicide but no weapons and no harm has been done to them. Then we connect them over and they'll speak to the clinician as of right now. So it's just the series of calls that we would call. So normally it's the protocol that we go through every day, daily, with the 911 operator. So if anyone calls with a medical emergency, like I said, it's the emergency medical dispatch protocol that we use. It's something that we always use for the last, I would say, probably like 10, 11 years that we've been using it. It's just a series of questions, and it lets us know how we're going to dispatch the call.
Thank you, everybody.